Welcome to Module 3, Food Insecurity, Healthcare Utilization, and Health Outcomes. The objective of this module is to help you understand how food insecurity impacts key healthcare metrics, like healthcare utilization, healthcare costs, health outcomes, and health equity. The ancillary materials included for this module and additional resources that you can find on the Medicaid Food Security Network website, medicaidfoodsecurity.network.org, will provide you with the information you need to link food insecurity strategies to the key priorities of the Medicaid partners in your area. Food insecurity is inextricably linked with health outcomes, impacting not only the prevalence and severity of diet-related disease, but also a person's overall physical, behavioral, and social health. Children experiencing food insecurity often have worse outcomes on metrics such as education, vocabulary, memory, attention and problem solving, cognitive functioning, gross and fine motor skills, and social emotional functioning. Children under 3 years old experiencing food insecurity are over 2 times more likely to be in fair or poor health. Teens experiencing food insecurity are 2.66 times more likely than their peers without food insecurity to have asthma. The data are profound, but there is hope. The length of time that a person experiences food insecurity impacts the severity of the associated outcomes. By reducing food insecurity in children, we can reduce the lifelong impacts of that food insecurity. Poor health directly correlates to higher utilization of not only needed healthcare services, but also potentially avoidable healthcare services, like ER visits. Multiple studies have shown significantly higher healthcare costs in adults experiencing food insecurity. Some studies have indicated that children in households experiencing food insecurity are more likely to lack a source of routine care and to use the emergency room more frequently. However, children in general have lower healthcare costs, making the relationship between food insecurity and healthcare utilization less clear. What is clear, however, is that the long-term health impacts of food insecurity that follow these children into adulthood impact future healthcare utilization and costs. As you will learn in later modules, Medicaid costs are of significant concern to states, and many states are actively identifying ways to reduce healthcare expenditures. Addressing food insecurity and other symptoms of disparities is a critical strategy for healthcare to address health inequities. Health equity is the principle underlying a commitment to reduce and ultimately eliminate disparities in health and in its determinants, including social determinants. Health disparities exist across various demographics, often deeply influenced by the social drivers of health, such as social, economic, and environmental factors. Black and brown communities are significantly more likely to experience food insecurity. As discussed earlier in this module, food insecurity increases prevalence of a wide range of physical, behavioral, and social conditions and can increase the severity of those conditions. Achieving health equity requires understanding and intentionally addressing these disparities and aligning resources and efforts accordingly. Food insecurity impacts health, which intersects with the healthcare system, and Medicaid offers an important avenue through which healthcare systems can become full partners in addressing the spectrum of food needs of children and families. Thank you for reviewing this module. We hope that you take away from this module that food insecurity impacts health, health equity, and healthcare costs, and could be a critical way for Medicaid agencies, payers, and providers to achieve their goals. We invite you to start building a case for how your state's Medicaid program can address food insecurity, and how that will connect to key state goals around health outcomes and healthcare costs. Here are a few questions to consider. What are your state's Medicaid priorities around cost and utilization? What would be the most impactful activities for the Medicaid agencies, payers, or providers to engage in regarding food insecurity?